Breaking 7,000 plus chikungunya cases hit China. What you need to know. A mosquito-borne virus has infected thousands in southern China, sparking concerns and raising questions about the disease's impact and spread. This outbreak is one of the most significant, since the virus was first detected in the country nearly 2 decades ago. The latest chikungunya outbreak has affected over 7,000 individuals in Foshan, a city in southern China, with sporadic cases reported in neighboring areas of Guangdong province. The severity of the situation prompted a vice premier to visit the affected district, emphasizing the need to control the spread within and outside the region. The rapid increase in infections also led to a travel warning issued by the US Centers for Disease Control and Prevention. Local authorities are taking action to combat the disease's spread, employing various epidemic control measures and innovative strategies to reduce the mosquito population. But what exactly is chikungunya? And why is it causing such concern? Chikungunya is a disease caused by a virus, transmitted primarily through the bites of infected female mosquitoes, such as Aedes aegypti and Aedes albopictus. These mosquitoes are known carriers of other pathogens, including those responsible for dengue and Zika infections. Symptoms typically appear within 4 to 8 days after a bite and include fever, fatigue, and nausea. But the hallmark of chikungunya is the severe joint pain that can persist for months or even years. The name chikungunya itself translates to that which bends up, reflecting the stooped posture of infected individuals due to the intense pain. While chikungunya is rarely fatal, a study published in Nature estimates that approximately 35.3 million people are infected annually across 180 countries and territories, resulting in around 3,700 deaths, 0.01% of cases. The World Health Organization, WHO, highlights that infants and the elderly are at higher risk of developing severe forms of the disease. Currently, there is no cure for chikungunya, and treatment focuses on managing symptoms. Chikungunya outbreaks have occurred in various regions over the years. After its initial detection in Tanzania, other African and Asian countries reported the disease. Urban outbreaks were recorded in Thailand in 1967 and India in the 1970s. In 2004, a massive outbreak originated in East Africa, particularly on Kenya's Lamu Island, where it infected 70% of the population. The disease then spread to nearby islands, including Mauritius and Seychelles. India faced a widespread outbreak in 2006, with almost 1.3 million suspected cases, mostly in Karnataka and Maharashtra provinces. Outbreaks also occurred in Southeast Asian countries like Singapore and Thailand, infecting thousands. In the U.S., the first locally acquired cases were reported in Florida, Texas, Puerto Rico, and the U.S. While the WHO assessed the risk of large-scale outbreaks in the U.S. as low, the possibility of indigenous transmission cycles could not be entirely ruled out. The current outbreak in China is concentrated in the Shunde district of Foshan, a city with a population of 9 million. From July 27 to August 2, approximately 2,892 new local cases were reported, with 95% of cases in Foshan. Hong Kong, a semi-autonomous region governed by China, reported its first imported case on August 4. China's CDC attributes the 2025 outbreak to imported cases, with the spread of the virus globally leading to inevitable imported infections in China. The presence of local transmission vectors, particularly Aedes mosquitoes, has fueled sustained local transmission cycles, resulting in concentrated small-scale outbreaks. The current flood and typhoon season has also increased mosquito activity, complicating disease prevention and control efforts, according to Kang Min, director of the Institute for Prevention and Control of Infectious Diseases at the Guangdong Provincial Center for Disease Control and Prevention. In response, Chinese authorities are employing strategies similar to those used during the COVID-19 pandemic, including mass testing, isolating infected individuals, and disinfecting entire neighborhoods. While a vaccine against chikungunya exists, it is not yet publicly available in China. The country's National Health Commission emphasizes preventive measures, such as promptly eliminating mosquito breeding grounds and reducing mosquito vector density as the primary means of preventing infection. These methods include using mosquito coils, repellents, mosquito nets, and other mosquito-repelling and killing techniques. In the U.S., 2 vaccines are available, and vaccination is recommended for those traveling to high-risk areas. Pregnant women are advised to reconsider travel and postpone vaccination until after delivery, according to the US CDC. China's chikungunya outbreak. What you need to know. A concerning health crisis is unfolding in China, with over 7,000 cases of a mosquito-borne virus reported in Guangdong province since July. This alarming situation has prompted authorities to implement measures reminiscent of those seen during the COVID-19 pandemic, raising questions about public health responses and the effectiveness of such strategies. In Foshan, the city most severely affected, individuals diagnosed with chikungunya are required to remain hospitalized. Their beds are equipped with mosquito nets to prevent further transmission, and they can only be discharged after either testing negative for the virus or completing a week-long stay in the hospital. Chikungunya is transmitted through the bite of an infected mosquito and is characterized by symptoms such as fever and intense joint pain, which can persist for years in some cases. While outbreaks of this virus are relatively uncommon in China, they are frequently reported in regions of South and Southeast Asia, as well as parts of Africa. So, just how widespread is this outbreak in China? Beyond Foshan, at least 12 other cities within Guangdong province have confirmed cases, with nearly 3,000 new infections reported in just the last week. On Monday, Hong Kong recorded its first case, a 12-year-old boy who developed symptoms after visiting Foshan in July. It's important to note that chikungunya is not contagious in the traditional sense. It only spreads when an infected person is bitten by a mosquito, which then goes on to bite others. Health officials have indicated that all reported cases thus far have been mild, with 95% of patients being discharged within a week. However, the unfamiliarity of the virus in China has led to public anxiety. One user on the Chinese social media platform Weibo expressed concern, stating, "This is scary. The prolonged consequences sound very painful." In light of the outbreak, the United States has advised travelers to China to exercise increased caution. What proactive steps is China taking to combat the spread of this virus? Authorities in Guangdong province have committed to implementing decisive and forceful measures to halt the virus's transmission. Individuals exhibiting symptoms such as fever, joint pain, or rashes are being encouraged to seek immediate medical attention for testing. Residents are also being urged to eliminate any stagnant water around their homes, found in places like flower pots, coffee machines, or unused bottles, under threat of fines reaching up to 10,000 yuan, approximately $1,400. In an innovative approach, officials are releasing large elephant mosquitoes that prey on smaller mosquitoes known to spread chikungunya, as well as introducing mosquito-eating fish into local lakes. Just last week, Foshan officials released 5,000 of these larvae-eating fish into the city's water bodies. Additionally, drones are being deployed in certain areas to identify sources of stagnant water. While some neighboring cities initially mandated a 14-day home quarantine for travelers from Foshan, this requirement has since been lifted. Many have drawn parallels between these current measures and those enforced during the pandemic, questioning their necessity. One Weibo user remarked, "These feel so familiar, but are they really necessary?" Another added, "What's the point of the quarantine? It's not as though an infected patient will then go around biting other people." During the pandemic, China implemented strict measures, including forced quarantines and sealing off residential buildings with little notice for extended periods. So, what exactly is chikungunya? Most individuals bitten by an infected mosquito will begin to show symptoms within 3 to 7 days. In addition to fever and joint pain, other symptoms may include rashes, headaches, muscle pain, and swollen joints. Generally, patients recover within a week. However, in severe cases, joint pain can linger for months or even years. Those at greater risk for severe illness include newborns, the elderly, and individuals with pre-existing health conditions such as heart disease or diabetes. Currently, There is no specific cure for chikungunya, but fatalities from the virus are rare. First identified in Tanzania in 1952, chikungunya has since spread to over 110 countries across sub-Saharan Africa and Southeast Asia. According to the World Health Organization, the most effective way to prevent the virus's spread is to eliminate stagnant water sources that serve as breeding grounds for mosquitoes. What are your thoughts on the measures being taken in response to this outbreak? Do you believe they are justified, or do you think they are excessive? Share your opinions in the comments below. CDC warns about chikungunya in China, what travelers need to know. A silent surge is sweeping across continents, and it's carried by a tiny insect. The chikungunya virus, a mosquito-borne illness once confined to tropical regions, is now making a dramatic global comeback. With over 240,000 cases and nearly 90 deaths reported in 2025 alone. https Transport Expert, Climate Change Transport Expert. Expert Epidemiology Update, June 2025. Health officials are sounding the alarm, and travelers need to pay attention. What's happening in China? This summer, Guangdong province has become a hotspot for chikungunya, with over 7,000 confirmed cases, particularly concentrated in Foshan. https www.cdc.gov/notices, Level 2, Chikungunya China. www.chp.gov. The US Centers for Disease Control and Prevention, CDC, has issued a Level 2 travel advisory for the region, urging visitors to take enhanced precautions like using insect repellent, wearing long sleeves, and staying in screened or air-conditioned accommodations. cdc.gov/travel notices/level 2/chikungunya. Should travelers even go at all? Pregnant individuals are especially advised to reconsider travel, as the virus can be passed to newborns during delivery, potentially causing severe illness. cdc.gov/travel notices/level 2 Chikungunya China. Where else is chikungunya spreading? The virus isn't just a concern in China. Outbreaks have been reported in Bolivia, Kenya, Madagascar, Mauritius, Mayotte, Reunion, Somalia, and Sri Lanka. 4/www.cdc.gov/data maps index HTML. Meanwhile, countries like Brazil, Colombia, Mexico, India, Pakistan, the Philippines, Thailand, and Nigeria are considered high-risk zones, even without current outbreaks. https://www.cdc.gov.index.html. According to the World Health Organization, WHO, a staggering 5.6 billion people live in areas vulnerable to arboviral diseases like chikungunya, dengue, Zika, and yellow fever. https://www.cdc.gov.index.html. www.who.int/publications/item 97824111110. Item is 1. How serious is it? Chikungunya typically causes fever, intense joint pain, swelling, headache, muscle aches, and rash. https://www.int/publications/id/chikungunya. Most people recover within 2 to 12 days, but some, especially the elderly, newborns, and those with chronic conditions, may suffer severe complications including cardiovascular, neurological, or multi-organ issues. 5. https://who.int/publications/item 978241110. And this is the part most people miss. There's no cure. There are no antiviral treatments for chikungunya. Pain and fever can be managed with medications like paracetamol, but care must be taken to avoid NSAIDs until dengue is ruled out due to bleeding risks. 6. https://who.int newsroom fact sheets detail. And what about vaccines? 2 vaccines, IXCHIQ and Vimkunya, have received regulatory approval in the US, but they're not widely available. 2. https://who.int newsroom fact sheets detail. Chikungunya. www.wnc.gov/travel notices level 2, Chikungunya, China. www.usatoday.com/news/room fact sheets detail. In fact, use of Ixkick has been paused for individuals over 60 due to reports of serious adverse events, including deaths. https://www.usatoday.story/health/2025/512. Are we rushing vaccine approvals without sufficient long-term data? A brief history of the virus. Chikungunya was first identified in Tanzania in 1952. https://ywho/newsroom factsheets detail/chikungunya. Since then, it has spread to over 119 countries. https://ywho.int. Publications item Chikungunya Epidemiology Update, June 2025. In 2024 alone, over 620,000 cases and 213 deaths were reported globally. https://ywho.int. Publications item Chikungunya Epidemiology Update, June 2025. Web wecdc.europa.eu and publications data/chikungunya virus disease case notification rate 100,000 population January 2024. One of the most explosive outbreaks occurred in the Indian Ocean region and India in the mid-2000s, affecting up to 60% of local populations. What are governments doing? In response to the outbreak, Chinese authorities convened a national conference to ramp up mosquito control, improve sanitation, and enhance public awareness. Visit who.int publications/chikungunya. .n.it. What are governments doing? enhc.gov.cn/2025-07-31C86503.htm. Hong Kong, though not currently experiencing local transmission, is on high alert due to its proximity and travel ties to Guangdong. https://www.hkfiles.pdf Consensus Statement on the Prevention and Control of Chikungunya Fever. PAV. Let's talk. Should travel advisories be stricter? With the virus spreading rapidly and no definitive treatment, some argue that travel warnings should be elevated to discourage non-essential visits to outbreak zones. Others believe informed precautions are enough. What do you think? Should governments impose stricter travel bans, or is that an overreaction? Drop your thoughts in the comments.